Hello, welcome to my channel. Before moving on to the video, if you liked the video, like the video, and subscribe to my channel. Thank you from now. Allergic rhinitis. The symptoms of allergic rhinitis. Unfavorably susceptible rhinitis, usually known as hay fever, is a hypersensitive reaction that influences the nose and aviation routes. The side effects can change in seriousness and may include wheezing. This is many times perhaps the earliest side effect to show up, and can be continuous and persevering. Runny or stodgy nose. The nasal sections might become clogged, hindered, or on the other hand, there might be an unmistakable release. Irritated nose, throat, and eyes. Irritation is a trademark side effect of hypersensitive rhinitis, and can be very troublesome. Watery eyes. The eyes might become red, bothersome, and watery, because of the hypersensitive response influencing the conjunctiva. Postnasal dribble. Abundant bodily fluid created by the nasal sections can trickle down the rear of the throat, prompting throat disturbance and hack. Exhaustion, steady wheezing, upset rest because of nasal blockage, and generally speaking, distress can prompt sleepiness and weariness. Hack. A tireless hack can grow, particularly due to postnasal dribble bothering the throat. Loss of smell and taste. Now and again, the feeling of smell and taste might be briefly impacted because of nasal blockage. Ear pressure. Eustachian tube brokenness can happen, prompting a vibe of completion or tension in the ears. Migraine. Sinus cerebral pains might grow, especially on the off chance that there is huge nasal clog. These side effects normally happen occasionally, for example, during dust seasons, or all year, and during hypersensitive rhinitis, set off by indoor allergens like residue bugs, pet dander, or shape. Unfavorably susceptible rhinitis can altogether influence personal satisfaction on the off chance that not oversaw as expected. However, different medicines like allergy medicines, nasal corticosteroids, and allergen aversion techniques can assist with easing side effects actually. Treatment of allergic rhinitis. Treatment for unfavorably susceptible rhinitis intends to lessen side effects and work on personal satisfaction. Here are the principal ways to deal with overseeing hypersensitive rhinitis. Allergen evasion. Recognizing and keeping away from allergens that trigger your side effects is the initial step. This might include procedures, for example, utilizing air purifiers with HEPA channels, keeping windows shut during high dust seasons, and consistently cleaning bedding to lessen openness to tidy parasites. Drugs. Allergy medicines. These medications block the activity of receptor, a substance delivered during hypersensitive responses. They can ease side effects like wheezing, tingling, and runny nose. Allergy medicines are accessible in oral structure, for example, loratadine, cetirizine, and as nasal splashes, for example, azelastine. Nasal corticosteroids. These splashes lessen irritation in the nasal sections and can really assuage side effects like nasal blockage, runny nose, and wheezing. Models incorporate fluticasone, Flones, budesonide, rhinocort, and mometasone, Nasonex. Decongestants. These prescriptions can give transient help from nasal clog by contracting enlarged nasal tissues. They are accessible in oral structure, for example, pseudoephedrine and nasal showers, for example, oxymetazoline. Nonetheless, nasal shower decongestants ought not be utilized for in excess of a couple of days to stay away from bounce-back blockage. Montelukast. This is a leukotriene receptor bad guy that can be utilized to treat unfavorably susceptible rhinitis, particularly in people with asthma too. E-drops. For alleviation of bothersome, watery eyes, allergy medicine eye drops, for example, cototofen, or pulse cell stabilizers, for example, cromolyn, can be viable. Immunotherapy, sensitivity shots, for people with serious sensitivities that don't answer well to drugs or allergen evasion. Allergen immunotherapy might be suggested. This includes getting customary infusions of allergens in progressively expanding dosages to desensitize the safe framework. Elective medicines. Certain individuals track down help from correlative treatments like saline nasal water system, utilizing a neti pot or saline splash needle therapy, or homegrown cures like butterbur, Petacetes hybridus. Be that as it may, the viability of these methodologies can fluctuate, and it's fundamental to talk with a medical care supplier prior to attempting them. Way of life adjustments. Keeping windows shut during high dust seasons, utilizing cooling with HEPA channels, and showering after open-air exercises can assist with decreasing allergen openness. Meeting with a subject matter expert, on the off chance that side effects are serious or not answering normal medicines. Seeing an allergist or an otolaryngologist, ear, nose, and throat trained professional, might be important to investigate extra treatment choices or affirm the conclusion. Viable administration of unfavorably susceptible rhinitis frequently includes a blend of these methodologies, customized to the singular's particular triggers and side effects. Customary development with a medical services supplier is vital to change therapies depending on the situation and guarantee ideal control of side effects. Allergic rhinitis diagnosis. Diagnosing hypersensitive rhinitis normally includes a blend of clinical history evaluation, actual assessment, and here and there, extra tests. This is the way medical services suppliers, for the most part, analyze unfavorably susceptible rhinitis. Clinical history. Your PCP will begin by posing itemized inquiries about your side effects, for example, when they began, how long they last, and whether they happen occasionally or all year. They will likewise ask about any triggers or factors that deteriorate your side effects, like openness to dust, residue, pets, or certain food sources. A family background of sensitivities may likewise be significant. Actual assessment. An intensive assessment of your nose, throat, and eyes will be led to evaluate for indications of irritation, nasal blockage, and unfavorably susceptible shiners, dark circles under the eyes because of clog. Sensitivity testing. Sensitivity testing might be prescribed to distinguish explicit allergens setting off your side effects. There are two primary sorts of sensitivity tests. Skin prick test. This is the most well-known strategy, where little measures of allergens are pricked into the skin, as a rule on the lower arm or back, and the skin response is noticed. A positive response, redness, enlarging, tingling, demonstrates aversion to that allergen. Blood test. Explicit EJ test. This blood test estimates the degrees of explicit EG antibodies created by the resistant framework in light of explicit allergens. It is especially helpful in the event that skin testing isn't practical, for example, because of serious dermatitis or meds that slow down testing. Extra tests. At times, extra tests might be requested to evaluate for difficulties or to preclude different circumstances that might introduce in basically the same manner to hypersensitive rhinitis. These tests might include nasal endoscopy, a strategy where a slim, adaptable cylinder with a camera is embedded into the nose to inspect the nasal sections and sinuses. Imaging studies, for example, CT examine. These might be utilized to assess the sinuses, assuming that there are persistent or extreme side effects. Differential determination. Your medical services supplier will consider different circumstances that can cause comparative side effects, like non-unfavorably susceptible rhinitis, for example, vasomotor rhinitis, sinus diseases, nasal polyps, or physical anomalies. Reaction to treatment. Some of the time, on the off chance that the determination is unsure, your PCP might endorse prescriptions, for example, nasal corticosteroids or allergy meds, to check whether there is a huge improvement in side effects. A positive reaction to these drugs can uphold the determination of hypersensitive rhinitis. Generally speaking, the conclusion of unfavorably susceptible rhinitis depends on a mix of clinical history, actual assessment discoveries, and in some cases, corroborative sensitivity testing. It's essential to work intimately with your medical services supplier to analyze and really deal with your condition precisely. Allergic rhinitis risk factors. A few gamble elements can improve the probability of creating unfavorably susceptible rhinitis, hay fever. These include family ancestry. Having a family background of sensitivities, like unfavorably susceptible rhinitis, asthma, or skin inflammation, builds your gamble. Hypersensitive propensities frequently run in families because of shared hereditary inclinations. Individual history of sensitivities. In the event that you have a past filled with other unfavorably susceptible circumstances, for example, dermatitis or food sensitivities, you are bound to foster hypersensitive rhinitis. Age. Unfavorably susceptible rhinitis can create at whatever stage in life, however it generally begins during youth or pre-adulthood. Notwithstanding, it can likewise foster further down the road. Openness to allergens. Normal openness to allergens like dust parasites, pet dander, shape spores, and certain food varieties can build your gamble of creating hypersensitive rhinitis. Living in conditions with high dust levels or indoor allergens can add to the advancement of side effects. Ecological elements. Natural factors like air contamination, changes in environment, and urbanization might assume a part in the rising pervasiveness of hypersensitive rhinitis in certain populaces. Word-related openness. Certain word-related openings to allergens or aggravations, like residue, synthetics, or vapor, can build the gamble of creating hypersensitive rhinitis. Smoking. Dynamic smoking or openness to handed-down cigarette smoke during youth can expand the gamble of creating hypersensitive rhinitis. Early life elements. Factors like early openness to allergens, method of conveyance upon entering the world, for example, cesarean segment versus vaginal conveyance, and early eating routine, for example, breastfeeding versus recipe taking care of, may impact the improvement of sensitivities, including unfavorably susceptible rhinitis. Stress. While not an immediate reason, stress and mental variables might compound side effects of hypersensitive rhinitis in certain people. Orientation. Unfavorably susceptible rhinitis will in general be more normal in guys during youth and in females during adulthood. Yet the purposes behind this distinction in sexual orientation are not totally clear. Understanding these gamble elements can assist with recognizing people who might be more helpless to creating unfavorably susceptible rhinitis and may profit from early intercession or preventive measures, like allergen evasion methodologies and fitting clinical administration. That's it for our video. If you liked the video, please like the video and subscribe to the channel. See you in other videos. Bye!